I'm Dr. Otto Slater. I'm a board-certified oral and maxillofacial surgeon and principal of Tennessee Valley Oral Surgery here in East Tennessee. Wisdom teeth are also known more commonly as third molars. Your first molar is also known as your six-year molar. It comes in roughly when you're 6 years old. Your second molar is commonly called the 12-year molar, typically erupts when you're about 12. And the wisdom tooth is the last tooth to erupt in your head. It typically shows up around age 18 or around adulthood, which is where it gets the moniker the wisdom tooth, because it's associated with maturity and age and wisdom. In many patients, they never erupt, and if they stay below the gum, that word for that is impacted. If they erupt and they're through the gum, this is actually my x-ray, and it shows my lower wisdom teeth. I still have them, and they're not decayed, and so I don't have really a reason to remove them, and I actually function on them. I chew on them. Some patients don't. They have wisdom teeth that are erupted, but they're not very cleansable and they decay. And rather than fill them, it's a more likely decision just to remove the tooth. I'm not so dogmatic as to say it's wrong to fill a wisdom tooth, but it's more commonly they're extracted because when they decay, it's usually well past the patient's sweets years, and the culprit is more access and cleansability, and there's just not room for them. Wisdom teeth, generally, the younger a patient has the surgery, the better they'll do post-op. In most patients, wisdom teeth is no more than a nuisance, and many are back at work the next day. Adult wisdom teeth tend to be a little bit more involved and a little bit more higher risk. Also, what is a factor is what is the condition of the tooth when someone comes in. If it's an asymptomatic wisdom tooth that's under the gum and no one knows about it, those surgeries go quickly, easily, and are recovered fast. If someone comes in on fire and swollen and badly diseased from a wisdom tooth, naturally their post-op course might be a little more involved. Very commonly, we're asked with wisdom teeth, when do they come out and when do they not? It's a very good question. The American Board of Oral Maxillofacial Surgeons commissioned a study on that several decades ago, and it led them to establish guidelines that these are not hard and fast rules, but they are the best guidelines that we have for evidence-based practitioners to follow as to guide us when do we get wisdom teeth out and when do we not. It showed that as a patient ages, the risks of the surgeries goes up, and goes up more significantly around age 25 to 27. So if a patient is younger than 25 to 27, if you have impacted wisdom teeth, it's recommended to get them out whether they're bothering you or not. Older than that, however, it's recommended to observe impacted wisdom teeth and not to take them out unless clear clinical signs or symptoms or radiographic signs present. For example, a common one is decay, or there's a fistula, there was a hole where you can see the tooth but you can't brush it. Or there's a tumor or cyst growing with one of the wisdom teeth. Very commonly in adult patients of 4 wisdom teeth, some meet criteria, same patient, same mouth, maybe 1 or 2 would meet criteria and others wouldn't. So I think it's very important that you get the straight story about wisdom teeth from a board certified oral surgeon. The old adage, when in doubt, get them out, that really doesn't fly. You should consult with your surgeon pre-op to determine, do I really have a reason to take out these teeth or not? You don't have to be put to sleep. On the other hand, you want the right tool for the job. It would be unusual for me to take a wisdom tooth out in a non-sedated patient. For example, many of our wisdom teeth patients are youngsters, maybe from 14 to 17 years old, and they've never had any type of medical procedure. And to go in and to remove impacted wisdom teeth under the gum, just numbing that up, let alone doing the surgery, would be extremely challenging. So you would want the right tool for the job. On the other hand, it would be also very unusual for me to have to go to the hospital and intubate someone on a ventilator for a wisdom tooth surgery. Most of these are done in the chair with an IV sedation where the patient is breathing for themselves right here in an office setting, where it's much kinder, it's much easier, it's much cheaper, recovery's quick. Very simple procedure. Wisdom teeth won't grow back. If you remove the entire tooth and the little dental papilla, the tooth won't grow back. most cases where it's been reported that a wisdom tooth has grown back, it's not impossible, but it's very rare. What is more likely is that a patient had an undiagnosed extra wisdom tooth that wasn't removed, and that's what is persisted in later radiographs. The number, the shape, and the size of wisdom teeth is highly variable. I've seen patients with as many as 12 wisdom teeth. If anybody develops symptoms from a wisdom tooth, they should get to see an oral maxillofacial surgeon right away, because time is their enemy. The longer it goes on, the more condition deteriorates, the worse your post-op outcomes are going to be and the more risky the surgery would be. Wisdom tooth pain can be very severe and can be quite serious. In fact, when I was a trauma surgeon at UT Medical Center, which is a level 1 trauma center for 18 years, we would occasionally see very serious dental infections that presented, and they were almost always from a lower second or wisdom tooth that had become infected and had caused very serious health threat to that patient. Take a look at our free guide about wisdom teeth on the Tennessee Valley Oral Surgery website. You'll find some good information there. If you have any questions or concerns or doubts about your own circumstance, call for an appointment. Talk to your surgeon one-on-one and to see how this specifically relates to you, because everybody's different, young, old, upper, lower. There's a lot of variables in wisdom tooth surgery, and I think it's important to get what's the straight story for you in your own healthcare.
Tennessee Valley Oral Surgery. We'll take care of you like family.